Hi, friends from Facebook, from Twitter, and maybe from as YouTube as well, because we also run in the YouTube style. Today we're going to discuss basically about endometriosis, which is a very important topic. The question will be, what is endometriosis? Maybe I should answer that first. Endometriosis is a chronic inflammatory condition or disease that leads to pain and infertility. Those are the two important factors, the pain and infertility. And this affects 25 to 50% of infertile women who have endometriosis. 30 to 50% of women coming for with endometriosis also have infertility problem. Now, the mechanism of ovarian tissue or damage due to endometriosis is very important. I want to start there so that we understand. Endometriosis can really affect your ovaries, and how it does in two ways. The first one is inflammatory reaction. In other words, the number of the immune cell increased, elevated cytokine, chemokines, reactive oxygen species as well, which we call ROS, and tissue fibrosis. The mechanical part of damage is compression of tissue, and ovarian tissues as well, get compromised. Then poor blood circulation to the ovary, and then there is no growth of any blood or to the ovary as well. Now, I want us to talk about the treatment of endometriosis in a woman desiring fertility. It's very important that we stress that. Now, when you look how women are affected in the reproductive age by endometriosis, it's very high. Actually, it affects a lot of women who are in reproductive age. It affects the quality of their life. And the treatment of these women, actually two ways, either surgery or doing what is called assisted reproductive technique. And the choice of treatment is very important, and it depends on the stage of the disease and the age of the women. Endometriosis as well, it affects fecundity of a woman. In other words, the ability to be pregnant is reduced by almost 1/3. Then the other important thing which we need to know is an impact of endometriosis on fertility. Now, I will usually say there's a hallmark of endometriosis, and these are two important things which I've discussed already. The first one is inflammatory process, and the second one is what we call adhesion formation by this condition. Now, what are these two things doing? The first, they distort the pelvic anatomy, they cause tubal blockage, they increase reactive oxygen species, which cause a high immune reaction. They affect formation of quality eggs, what we call follicogenesis, and also affect the sperm motility and even movement into the pelvis. Then diagnosis of endometriosis is very important, and I think the symptoms are clear, but I want to stress two things: dysmenorrhea and probably dyspareunia. Dysmenorrhea is a painful menstruation, and this condition is usually overlooked in young women because everyone said, no, when you have menstruation, you can have pain and something like that. But not. Because it's very important that if you are a young woman and you start having your menstruation and you have terrible pain and you have 2 or 3 days which you can't go to school, or you started vomiting and so forth, in these young women, it's very important that we exclude endometriosis at all costs. Now, the studies have shown that the diagnosis of endometriosis is made after about 10 years in a woman. Therefore, women will go up and down, seen by GP, seen by even gynae specialists, but they never diagnose endometriosis. And the time we make a diagnosis of this condition is 10 years later, and the damage has been done already. Now, there are two things in diagnosis which are important. The first one is the role of MRI, which I'll discuss in detail, and laparoscopy is the gold standard in diagnosis and in diagnosing endometriosis. Therefore, to diagnose endometriosis, most likely you'll need to do what we call laparoscopy, and especially in the mild and moderate. We shall discuss them later. Now, treatment option for endometriosis. Treatment option is centered around two questions, really. The first question is, Is a surgical treatment of endometriosis advisable to improve fertility in these women? Should the couple try to conceive spontaneously longer or seek ART, which is assisted reproductive technique? Therefore, the surgeon or the doctor who's actually addressing the patient must answer this question before he can move on. The most appropriate treatment depend on few things or parameters. The first one is the age. The second one is a duration of infertility. And the other one is ovarian reserve. That's the third one. The other important one is sperm analysis. And, as well, the fifth one, it will be a thorough history taking, and post, or if the patient had any operation, is very important. Therefore, those are the very important things which we all have to do as fertility specialists, so that we can help those women. Now, classification system of endometriosis, actually we've got two systems. I'll talk of American Fertility Society score, but the limit in this system, it doesn't really tell or predict the pregnancy rate in these women. And the other system is called Endometriosis Fertility Index. This assessment usually give a number, and this is very important, and we use it for, as fertility specialists, so that we can determine whether the woman will be pregnant or not, because it looks at the tubes, it looks at the fimbria, and it looks at as well as the ovaries, and it's scored there from 0 to 10. Let's say, for argument's sake, endometriosis fertility index is less than 4. There's 20% chance that you may, deliver spontaneously. If EFI is greater than 7, you've got 40 to 45% chance. Therefore, it's very important. On top of this, we have also to remember that the age is very important and play an important role. Treating of endometriosis couple who want to be pregnant, the surgery which must be done is very critical, and the surgical approach has to be individualized and then actually tapered towards the patient's problem, right? Then staging of endometriosis, according to American Society, stage 1 or 2. Stage 1 is minimal and moderate. Stage 2 is when it's more moderate. But in stage 1 and 2 of endometriosis, normal ovarian reserve is very important to look at, and also look at the sperm analysis. Then meta-analysis looking at stage 1 and 2 endometriosis find that this patient with stage 1, you can suggest them that they should try to be pregnant and give them probably a duration of 12 to 24 months. And normal ovarian reserve is important, and normal sperm count, and the age should be less than 35. Some people will say probably 39, but 35, I think it's a cutting age, and spontaneous pregnancy can happen. Now, in stage 3 and 4 is those one which severe endometriosis, and is very challenging scenario. Age is of vital importance in this group, and ovarian reserve also is very important. Therefore, as a surgeon, we have to look at those before you can do anything. An expert surgeon is actually required to do this kind of patient, because they have a lot and high complication, and it's better that somebody who's very experienced in endometriosis to do this kind of procedure. And in all these patients of stage 3 and 4, an assisted reproductive technique may be used to get this patient pregnant as well. Now, looking at ovarian endometrioma, it's a very important. What is ovarian endometrioma? Endometrioma, it means it's an endometriosis in the ovary. Some people call it a chocolate cyst. Now, we don't have really a lot of study or random controlled trial which can actually answer the question, is it better to operate this patient or is it not to operate? But most of the studies, they say 50% of the patient probably will be pregnant on their own. But the other important factor which must come in is the size of endometrium. If the size is more than 3 centimeters, it's better to operate this patient. Now, when you do operation, you can do cystectomy. And in the histology of those patients where the part of the ovary was removed, cystectomy, it was found that the normal 80% have normal ovary. And then other studies will recommend that you do vaporization or coagulation, which suggest is better option. Now, looking at the other problem as well, which is we call a deep endometriosis or a DIE. It means it's an endometriosis which affect the rectovaginal area. It means a big infiltrating endometriosis, and it can affect the bowel, can affect the bladder or the ureter. Rectovaginal septum as well, removal. We don't know if we remove this condition will improve the chances of the patient to be pregnant. However, if pain is there, it will probably dyspareunia and so forth, then we assume that surgery will help the patient to be pregnant. The bowel surgery as well, we've got many types. You can do shaving, you can do discoid, or you can actually do segmental resection, which all of them, they're very good, especially for pain, and also may be better to increase the chances that this woman can be pregnant. Then the other thing I would like also us to discuss, while treatment of deep endometriosis provides benefit in terms of pain relief, we don't know really, as I said, that it increases the chances of fertility, but for pain it really will help. Okay? Then the other important issue is that endometriosis and medical assisted reproduction. Why? As I said, all the stage 2 and 3, 3 and 4, which are severe endometriosis, it will be better for those patients probably to do surgery and go straight for IVI or IUI, which may help them to get pregnant, depending on the condition, especially first of the tubes, the fimbriae, and so forth, and as well as the age of the patient. But for stage 1 and 2, really surgery may be helpful. Sometimes pregnancy may happen on itself spontaneously. Fine. Then in closing, I would say in vitro fertilization is really sometimes very good for patients who have got advanced disease, but it may be important that surgery, this patient go for surgery, then after that they go straight for IVF or ICSI. In summarizing the whole condition, I would say looking at the patient with infertility or with the desire to get pregnant, is very important that the first step, before you do any surgery or anything, is to do what is called ovarian reserve. Those patients who are above 35 and with a poor ovarian reserve, they should be quickly sent for IVF or ICSI, actually, in other words, assisted reproduction technique. And those patients who are less than 35 with a good ovarian reserve, it's better to do a thorough ultrasound so that the staging of the condition is done through an ultrasound or MRI. And if it's a mild or moderate or minimum condition, then we can do expected management and try to help those patients without any surgery. But if it's found that it's moderate or it's severe endometriosis, probably surgical approach is more important. Then quickly those patients can go for assisted reproductive technique after that. Thank you all.